Welcome to This Explainer. Today, we're tackling a subject that, quite frankly, has massive, literal life or death stakes. We're talking about cybersecurity and digital health. You know, when we hear the word cybersecurity, it's so easy to just picture some hacker in a dark hoodie stealing credit card numbers. But in the medical world, the stakes are entirely different. We aren't just protecting data on a server anymore. We're literally protecting patients in hospital beds. So before you even think about touching a keyboard to learn advanced hacking or defense tools like Nmap, Wireshark, or Metasploit, we have to stop and ask a really critical question. Why does this actually matter? Why are we learning these tools in the first place? Because if you dive straight into the software, it just becomes rote memorization. You're learning commands without any real meaning behind them. And that brings us to the absolute core thesis of our explainer today. We've got to understand the why before we can ever master the how. This is the foundational bedrock that every practical, technical skill is built upon. Once you grasp exactly what we're defending and the very real human cost of a breach, those technical tools are going to become powerful instruments in your hands, rather than just a boring list of commands to remember. To get us there, here's our game plan for today. We'll start with the digital health shift, then we'll use a hospital house metaphor to ground things. After that, we'll look at why this is a patient safety issue, break down the CIA triad, cover common healthcare cyber threats, and finally, look at the devastating WannaCry case study. All right, let's dive right into our first topic, the digital health shift and the move to modern medical records. Let's contrast our past with our present for a second. Think about traditional paper records. They were so easy to lose in a filing cabinet, incredibly difficult to share between departments, and honestly, almost impossible to analyze at a large scale. Now, look at the transition to digital records. They give clinicians lightning-fast access, make sharing across facilities seamless, and vastly improve care coordination. But, and this is a massive but, digital systems create digital risks. The very speed and interconnectivity that make modern healthcare so amazing, they also create a massive new attack surface. Moving on to Section 2, the hospital house metaphor and how we protect the inside. Okay, I want you to imagine a hospital as a massive house. Inside this house, you have everything that matters: vulnerable patients, working doctors, vital medicines, and highly sensitive medical records. Now, picture a malicious intruder successfully bypassing the front door and slipping inside. Once inside, they aren't just looking around. They could open up the filing cabinets and maliciously alter records. Imagine an intruder erasing a patient's known drug allergies or completely changing their diagnosis in the dead of night. It's terrifying. But it actually gets worse. What if this intruder goes around putting heavy padlocks on every single door in the house? They could completely lock doctors out of the hospital systems. The clinicians are standing right there, ready to help, but they're entirely blocked from doing their jobs. And in the most terrifying scenario of all, this intruder could literally walk into the intensive care unit and shut off life-saving equipment. This isn't some science fiction movie, folks. This is the very real reality of a compromised network. That brings us to Section 3. This is a patient safety issue, and it's about way more than just IT. The absolute crucial point here is this: cybersecurity protects lives, not just data. Picture a patient arriving in the emergency department in critical condition. The doctor urgently needs access to their medical history, their past diagnoses, and critically their drug allergies. But suddenly, a cyber attack takes the hospital systems offline. The doctor's flying blind, care is delayed, and patient safety is instantly compromised. When you secure a network in a hospital, you are directly protecting that patient on the gurney. This really shows just how interconnected the modern hospital is. We aren't just defending one computer, we're defending an entire digital health ecosystem. We've got the EMR holding patient demographics, we have the LIS managing lab workflows, there's the RAS for radiology scheduling, the PACS for archiving his massive MRI files, all the way up to the DHIS2 for national health reporting. It's a massive web, and a weakness in just one of these systems can cascade and bring down the whole shebang. Okay, let's jump to Section 4, the CIA triad, which is our core security framework. Let's break down the 3 pillars of cybersecurity and apply them directly to the hospital floor. First up, confidentiality. The core question here is, who should access this? If an authorized nurse views a patient's HIV status, that's care. If an unauthorized stranger views it, well, confidentiality is breached. Second, we have integrity. Is the information actually accurate? If a patient's blood group is secretly changed by an attacker from A+ to B+, that data is no longer trustworthy, and that could have literal fatal consequences. Finally, availability. Can users access the data when they actually need it?
If a hospital system goes down right in the middle of a critical surgery, even if nothing was stolen, availability has been destroyed, and that patient is in immediate danger.
Moving right along to Section 5, Common Healthcare Cyber Threats. It's time to start knowing your enemy.
Attackers have a pretty diverse toolkit, and they're constantly probing for weaknesses. Malware, like viruses and Trojans, is a persistent threat. Then there's phishing, which really relies on human error, sending fraudulent emails to trick a busy nurse or doctor into handing over their credentials. We also have to watch out for insider threats. Now, this isn't always malicious data theft. Sometimes it's just simple negligence, like leaving a computer unlocked in a busy hallway. But the absolute most crippling threat facing healthcare today: ransomware. This is when attackers encrypt all the files, lock down the entire hospital system, and demand a massive payment to restore access.
Which brings us to our final section, Section 6, the WannaCry case study, and a look at real-world impact. Back in 2017, the WannaCry ransomware attacks swept across the globe, and healthcare was among the hardest-hit sectors. What happened was essentially a perfect storm. The malware exploited systems that were simply unpatched. They just hadn't been updated. The result? Hospitals entirely lost access to their electronic medical records, their diagnostic tools, and their scheduling systems. The real-world impact was immediate and terrifying. Surgeries were literally canceled midday, ambulances full of critical patients had to be diverted away from the nearest hospitals, and patient care was severely delayed across multiple countries.
We've seen the incredible benefits of the digital health shift, but we've also seen exactly what happens when the digital house is left unlocked. One single unpatched vulnerability can bring a global medical system to its knees. So I'll leave you with this provocative thought as we wrap up. Is your hospital's digital house truly secure? Understanding these massive stakes is exactly why you need to master the practical tools we'll be covering next. Thanks so much for joining me on this explainer. Stay curious, and I'll see you next time.